Great, welcome everyone to progress on the 2020 to 2025 Community Plan to End Homelessness as part of Silicon Valley at Home's Affordable Housing Month. My name is Bila Lindner. I work for an organization called Home Base, which is a technical assistance and training provider in Santa Clara County. I am going to go ahead and hand it off to Consuelo, who is going to go ahead and give us an introduction to our event today.
Thank you, Bila. Good evening, everybody. Consuelo Hernandez, Director for the Office of Supportive Housing. As you all know, we typically host this event in person. For those of you that are joining us for the first time, we have historically met in person with breakout rooms and had a really robust discussion with feedback. And in true COVID land, we are adjusting. And maybe in the chat, we can share with you, this is the second event that we're hosting. Last week, we shared a couple of projects that are in the pipeline. We did this virtual tour to show people the work that we're doing in spite of everything that's happened over the last 18 months or so in response to COVID. And I think this report and everything you'll hear today is a testament to the great partnership in this county that even during a pandemic and with all of the challenges in our county that we're still able to make progress. We have a lot of work ahead, but none of this could be done without this true partnership that we have. I will leave it there and I will hand it over to Bila. Thank you, Bila.
Thank you. So before we get started, I wanted to go over some tech reminders just for everyone who's here. We are recording this event and you all are muted, and we ask that you remain muted unless you're speaking up to ask a question during one of the Q&As or you're participating in one of the breakout sessions. If you have technical issues, please feel free to put that in the chat and we'll help you address it. Feel free also to ask questions in the chat. We also want to note that we have closed captioning available for folks, and you can access that by clicking on live transcript at the bottom. It would be great if at this point everyone could go ahead and practice using the chat box by putting your name in and briefly introducing yourself, letting us know your name and affiliation if you have one. Okay, so now that we've done our tech reminders, I'm going to go ahead and introduce Celine Chandler of the Santa Clara County Lived Experience Advisory Board, or LEAB. She's going to tell us about the importance of lived experience advisory boards and also share with us some of the great work that the LEAB has been doing to end homelessness in Santa Clara County.
Hello, everyone. Again, my name is Celine Chandler. I'm on the Lived Experience Advisory Board with Destination Home, and I'm also an executive committee member. Also my comrade, I'm not sure if he's on the call, but his name's Mike Eckhart. And today, you can go to the next slide. So today we just want to do a sort of a quick overview, and then I'll get into the work that we're currently doing. So right now, a few years ago when the League first started, there was a real need for the voice of the community, the voice of the unhoused, currently and formerly, to be involved. We have 3 strategies with our community plan to end homelessness. And I think that LEAB has definitely gotten on all 3 levels of the strategies. The policy making, being involved in a lot of the decisions and having sort of a seat at the table, sitting on boards. One of our members is on the board at Destination Home, also providing direct services, and just sort of being decision makers in the community. There's actually a lot of clients or unhoused folks that want to get involved. You'd be surprised how many people are eager to actually start making a change, because the people that are most affected are also the people who have insight. They have gainful insight into what it's like to be someone with lived experience. So our sort of motto is nothing about us without us. And I see other lived experience boards are sort of taking on that motto of just no services, no money, no things happening without us that are about us. And sort of raising awareness on both ends for the unhoused community to learn how services works, but also for the service providers to learn what lived experience is, and how we navigate our lived experience of homelessness. So some of the big benefits is that the insightful feedback that you get in real time, you get a more realistic perspective. And you get to, when you talk to people who have been through it, you get to really measure your success on a deeper level than just numbers. It's more of getting like a quality feedback rather than just quantity. You get fostering the development of people who have lived experience. It gives a sense of community, that we have a say in what's going on that affects us, and sort of giving the power back to us. And also being in that community, being in LEAB, you get a sense of normalization, that you're not the only one who's going through it, and feeling empowered, that you can do something to address root causes of homelessness. And overall, everyone gets better outcomes. I mean, in terms of the community plan, you're going to get better outcomes because you're involving people with lived experience. You get more effective programming. If people were going through a program, but then they're back in the same predicament a couple of years later, I mean, you haven't really succeeded. People fall through the cracks, and having a lead really lets you know how folks are falling through the cracks. And you get a different perspective. You get the client point of view, and it's valued, and it needs to be included on all levels of this community plan. And it's very important to include people who are service resistant, people who are very critical, because their critiques can really start closing those gaps in services, start closing those gaps in people who fall through the cracks, people who are being turned away from services, and just overall people who are service resistant. I myself was very service resistant. I was in foster care, so I had a hard relationship with the system, which was that, yes, the system's there to help you, but then there's a lot of hindrances, there's a lot of barriers, and you sort of get frustrated navigating the help to where it stops being help. So if if the help doesn't know that, then they're not being as effective in their programming. So I think it gives you more realistic, in real time, very insightful feedback. Next slide. So forming a LEAB, just to back up a little bit. So a LEAB is a board of folks who have either been homeless or are currently unhoused. And this is our way of giving feedback, but it needs to be organized. So those who are, thinking about starting a consumer feedback group, here's some points that could really help you get started. So with the purpose and goals, you really want to define the mission and define what you want to get out of the group. You also want to recruit, but then allow those who are already recruited to join the recruiting efforts as well. Anytime there's work that needs to be done, allow the members of the group leeway to take on the work themselves, but just give them the support they need. Again, it's really important to recruit those who have a lack of trust with the system, because then you're starting to break down those barriers between the community of those who are being served and those who are in service. Though actually those people who are sort of service resistant are actually the most valuable. Their voices matter, because they may feel defeated or feel disempowered, but when they get in that empowered position, their hypercritical feedback is really going to help you guys. Those are the people that you actually really want to focus on recruiting. Sort of the troublemakers. I was one. um, and of course, those who feel that change is necessary and are motivated by the mission and willing to do the work. And support is a huge part in working with the unhoused community. We need support in getting to and from meetings, accessing technology, food, and most important, stipend. I mean, you have to compensate for lived experience work. It is work. You're compensated for your work, so we should be too. And that's how you really establish that you value the voices of the participants, is by supporting them and giving them access to do their work, pretty much provide the space for us to do our work. Um, Develop leadership positions and opportunities for deeper involvement, so people can have a sense of ownership and almost like autonomy of the work that they've chosen to take on. It's good to establish bylaws for, keeping expectations clear and for folks knowing how to conduct themselves, and also be flexible. Be willing to change, adapt, listen to feedback in real time, listen to what folks are saying they need to continue to do the work. If people are interested in taking on more, it's important not to shut them down, but more just to foster and facilitate and support. But be flexible, be willing to set a budget aside for this, be willing to make some changes within your organization, right? Don't ask for feedback and then not be willing to make those changes. On all levels. That could be the way that the board is organized. It could be what the work that they're trying to do or the direction they're trying to go. Destination Home has been really supportive of the Lived Experience Advisory Board there. So I thank you guys. Thank y'all. Next slide. So key elements for success. One of the first things we did was getting the buy-in from the COC. And now we're starting to see that it's even more important. And I see it's even going to be required at some point that people with lived experiences are on boards, that they're on, that they have a seat at the table, and basically nothing about us without us. So that was a big deal, getting the support from the COC, creating a structured environment. You really want to focus on leadership from Black, Indigenous people of color, that you have a diverse representation, because those are the people who have been most affected by the system. And those who have been most affected are the most informed. They're the most aware. So you want to create spaces for Black, Indigenous people of color to do their own work, but it is their work. And that we are repairing the harms of colonization and slavery. So when we talk about, not over policing and decriminalizing and stop sweeping the encampments in the communities, it's also about, providing land and reparations in the form of these programs, if that makes sense. This is sort of our decolonization process, using trauma-informed approaches, therapy that's led by survivors, peer-led respite models for tent cities, hotels, reentry centers from people who have been incarcerated, shelters, and really any program. All services and programs should be sort of led, coordinated by and with folks with lived experience. If it's not, it's questionable. And that's from a person with lived experience. And so just, for food for thought, it's like, what does that look like? Housing with dignity for all. What does housing for all look like in this county? What is housing with dignity? Because there are some housing units without dignity. And how can we dignify and provide housing for all, and include those who are affected in that process. Nothing about us without us. Next slide, please. So what do? We do a lot. We have expanded these this list of what we do over the last 2-3 years from maybe 4 or 5 things to like 15, 20 things now. We're still working with COC. We work very closely with Destination Home, and they're very supportive in helping us build strategic partnerships, working with the city, working with the county, different groups, and also continuing to foster the development of people with lived experience and sort of just validating validating the fact that our voices are valuable. And I think organizations are starting to see that. People are having more talks about lived experience, not just in the homeless community, but foster youth groups, veteran groups. So when it comes to this community plan to end homelessness, I think one of the most critical parts is the inclusion of the unhoused community, because we know because we've been through it. So next slide. So what have we accomplished? Like I said, we've taken on a lot of roles. We've facilitated feedback sessions with clients and staff on site at different organizations that are providing services, shelters. We've advised and recommended and made feedback packets basically based on what clients and staff are saying. And the thing about the clients is like, they're not going to want to open up directly with providers per se, unless there's some sort of trust. And I feel privileged from someone with lived experience to be able to go back at a shelter I stayed at and say, hey, I was here and I went through this, and you can trust me that when you share this feedback, one, your name's protected, you're not going to lose your services, right? Because usually if you complain or something like that, you're getting kicked out, or you're going to be on the shit list. You might get close to getting kicked out. So it was really important that we built that trust in the community, that they don't feel like they're going to lose services by speaking up and speaking out. And then just that sense of community, like, whoa, they care. And also just meeting people with lived experience who aren't currently unhoused anymore. Like, I feel like them interacting with us, it was like, it leveled the playing field and it normalized their experience. And while I was homeless, if I had ran into a LEAD type of thing, man, that would have been home for me. I mean, LEAD is home now, but I wish this would have started sooner. And that's what a lot of us say that are in the group. It's like, man, we wish we had this sooner, because the sense of community is really strong and it's very empowering. We partner with service providers. We do food distribution. We really amped that up in response to COVID-19. A lot of the providers who go out into encampments and do outreach were slowing down, if not shutting down last year due to COVID. So we sort of just stepped up to the task. Not necessarily with the tools and everything, but we had Destination Home support. And now we regularly are going out there. We've coordinated with the task force for currently unhoused, talking about how to deal with encampments. And, there was a ban on the sweeps and stuff like that, getting folks services, getting them sanitation and things like that. Being able to use the restroom, wash your hands is critical during COVID. I mean, with the situation that was going on, it felt like it was between life and death. And if LEAD didn't step up, it was leaning more toward death. So, and that's the thing, like when you deal with people with lived experience, when lived experience folks are doing the work, our hearts are in it. Our hearts are in it. That's not something that can be taught. That's not something that can be, that's just folks with lived experience. They have the biggest heart. You'll be surprised how many homeless people that are in the street are helping each other, and there's just a strong sense of community. So people with lived experience love to help. The Oh yeah, we've reviewed development projects, housing developments, and sort of make recommendations, put our stamp of approval, or tell them what they need to change, if we have the capacity um, to get heavily involved. But and we've sort of just been the voice of the unhoused. There hasn't really been a central, I don't know, voice for the homeless community. Um, and we continue to do community outreach and engagement, because the dynamics are always changing. You all know, you work in services, that things are always changing quickly, especially during COVID. So it's good for us to be like the eyes and ears out there on the street, listening, getting real-time feedback. How are these policies affecting people? How were when all of those laws were changing and the shelter in place and all that stuff, we were out there. Leave was out there. And that's the knowledge and expertise that people with lived experience bring to the table. It's an expertise, and it's not necessarily something that can be studied. You got to live it. And by doing this, I think overall we've just been bridging the gap between service providers and the participants too. I think there's just this sort of power dynamic that's like, I'm the provider and you're the client, and that's separate. And as you start to put former clients in leadership roles in the organization, then it becomes their organization, if that makes sense. Like, it becomes a shared mission. And we're not, it's not like when I was in foster care, I struggled with authority, because authority sometimes meant limitations. Authority was intimidating. So when I got into dealing with services while I was unhoused and trying to navigate services, it that spilled over. I was resistant to services and getting help because of my previous relationship, which people with experience in the criminal justice system are even more service resistant, right? People with certain racial experiences, or have been discriminated against or whatever, those are the most resistant, but those are actually the people that you want to recruit, the most service resistant. And bridging that gap, and all of us taking ownership of the community together. It's not a us and them. Involve us. Next slide. So plans for 2021, post-COVID era, we are doing a lot of work. We're stepping it up. Right now, we're really restructuring and changing our bylaws and the structure of the organization, so we can take on like a lot more work. Because we went from just sort of showing up to a couple hours and giving feedback about other projects, to literally starting our own projects and being a key partner. And like, I feel like it blew up overnight. It's like over the last couple of years, everyone wants to hear from Leap now. They're like, what does Leap have to say about this? Can we get their stamp of approval? We need feedback. And sort of just the demand for the work has just like, woo. So, and it's been very exciting. The momentum is still going and growing. So we've put a cap on our membership at 19. Just because we can't support everybody, but we're growing exponentially, which means that there was always a huge need for a lead. Every organization should have some sort of consumer feedback, because there was such a big need that we had to sort of step back and revamp and say, hey, what can we do and what can't we do? Because there's a lot of people who want to hear from people with lived experience. We're also working on developing our skills and technical training, because when we come to the community, we want to be professional and presentable and have the skills to work the computer and the phone and be on this Zoom call, for example. All those things require support and skills. So wherever there's a lack of need, it's like wherever I'm strong at and my strengths, I'll expand on that. And if someone else is weak in that area, we all help each other. When we need more support, then we go to home base or destination home. Many of us don't, we don't got degrees and stuff like that, but we have our lived experience, and that is sort of our qualification. But then beyond that, we need more training. We're consulting community projects, and we're building strategic partnerships that ensure people with lived experience are at the table moving forward, and doing more outreach to the currently unhoused and removing their barriers for participation. So thank you all. That was my presentation. I have questions for you all, but I would like to hear your questions first. I'm not sure how we're like navigating questions, if it's going to go in the chat or if people are just going to chime in.
Yeah, so anyone with questions, you can go ahead and put them in the chat and we'll read them out. We're going to have, I think, a few minutes for Q&A and give folks some time to type those questions in the chat. And Celine, I can play, or Nicole or I can play the role of reading out the questions in the chat.
And if there are no questions, I didn't get a chance to go over everyone who's on the call, but just food for thought is, the first question is like, what does a lived experience board look like for your organization? Okay, there we go. Good. Okay. How do you approach someone that's service resistant? When me being someone with lived experience is a little bit different than someone like say a program staff or something reaching out, but I would support. Okay, I would, as someone with lived experience, when I talk to people who are service resistant, like, oh, I don't want to work with them because they're the problem, sort of opening up the dialogue about what level of work that we're doing so they can see how it's possible and what the need actually is. Because some people feel like they can't make a difference. It's sort of like voting. Some Americans don't vote because they don't think their vote's going to count. But if you can talk to people about current efforts and what does work, and start of giving them the idea that they are so valuable. And not just that, it comes down to the money sometimes. Hey, show up, you get a couple stipends or a gift card. Some people just show up for the gift card or the food. Okay, I enjoy the food, destination home, thank you. So what kind of support does the lead need from the community? It's not just the lead at destination home. We need support by other organizations starting their advisory boards as well. The community in general should support the idea of people with lived experience leading the solutions. And this is sort of the start of it, right? I'm someone with lived experience, and I'm speaking about the community plan in homelessness in 2020, which, is 2021. It didn't happen, but we're still working on it, right? So it's really that we're changing the dynamic that a client is someone who just needs to be served versus serving themselves through being involved in that process. And that shifting the power to them is important, because then we feel empowered. I felt empowered when our group sort of transitioned from being told what to do to us saying, like, deciding what we want to do. There was that's where the momentum really picked up the last couple of years, because when someone's telling you what to do, it feels like they're telling you what you need. But how can someone tell me what I need when I live the experience? So shifting the power was important because one, people aren't going to want to be involved if they feel like they're just going to be some okey doke or what's the word? Sort of like a poster child, which I've been used in that capacity, and it doesn't feel good. That you're just sort of a face, or people use your story, but they're not really getting your opinion or your insight or learning about your lived experience. So in Santa Clara County, it's really everywhere. It's not just Santa Clara County, but I think we can start spreading the idea of LEAD throughout the county and then throughout the state. It's booming in Canada. The biggest challenge you face with your peers, and how do you work to overcome it? Oh, Lord God. I can't even put my finger on the biggest challenge. Honestly, it's not even with my peers, it's with myself that I get frustrated in the line of work because I have mental health issues that have come up. I get triggered. We're talking about stuff that's like has affected me on a very deep level. And there are times where I feel like I want to make such a big difference, but there's so much work to do and I get overwhelmed. And I'm sure anyone in this line of work does. But when you have lived experience and you feel like you're failing your peers or you're not doing enough, you just sort of get overwhelmed, but you also take it really personal. And that's actually been my biggest challenge. It's not necessarily working, like my challenge is not with working with my peers. My challenge is working with my lived experience and being able to continue to have talks about things that were affecting me on such a deep level. And we've been talking about that in our group, how, there are times where, we may need deeper levels of support that we were not necessarily aware of. Another challenge is that people are still homeless. There's people who are still living in their car or unstably housed. Maybe they need to show up to a meeting or present, or in last minute they can't, or something comes up. When you're navigating lived experience, you need a lot of support to do this work. I'm not currently unhoused, thank God. But some of my peers are, and it's hard because when you're unhoused, things are unpredictable. So you might drop the ball on some big opportunity because something crazy came up, but crazy things come up all the time when you're homeless. Your home can be swept away, or, just anything. The one big disconnect between the needs of the homeless and provided, there's so many disconnects. I wouldn't say there's one big one, but the one we're working on and talking about right now is involving the voice of the homeless. That's pretty much the big disconnect. If people were taking on that model of peer leadership or client leadership, I think that some needs would be better addressed. And yes, Ingrid, I don't want to be tokenized. And because I'm so well spoken and I went to San Jose State University, I feel like I have been in some capacities, because people are like, oh, you're the homeless person that made it, or you're doing well because you went to San Jose State, or you make it look so good. And I don't want to be tokenized, because those are, there are people out there who may not have the skills, but they have the talent, or they have they have the desire. So we should create a community where we're fostering their leadership and their development. So thank you everyone for your questions. If you want to contact me personally, my email's in the chat. If you want to work with LEAD or get more information, definitely reach out.
Thank you very, very much, Celine, for joining us. We really appreciate hearing from you. And thank you all for your questions. We are going to go ahead now and hear from Catherine Kaminsky from the Office of Supportive Housing.
I gotta follow Celine. That's like
Sorry
rough.
about that.
So thank you all for joining us here, and thank you, Celine, so much for sharing your experience, your knowledge. You know, I think the work, the privilege that I've had of working with LEAB has been one of the best experiences I've had in my career and just personally in my life too, getting to know folks.
Wow.
And just has made the work so much more meaningful. So, and
you're our biggest support kid, Jay. You've been there.
well,
the bad and the rough times.
And I think the work that the partnerships that we've built, and then we're still building, we haven't gotten there. You know, I think speaking from the county's perspective, you know, when we set out to develop this plan, the community plan, we have two guiding values. The first is that we'll raise the voices of people with lived experience and share power with our unhoused neighbors. And I think we're still learning how to do that. LEAB is helping us learn how to do that better as an organization, as the continuum of care, as the county. And the second is that we will work to focus on policies and programs that are going to reduce the racial inequities in an effort to reverse the disproportionately rate of people of color who are unhoused in our community. So I think the work that LEAB is doing is helping us learn how to do better in both of those areas and integrate that throughout the strategies of our plan. So the three strategies you see here on the screen are the sort of focus areas. I'm not going to go in a lot of detail, and the plan has been out for a while, so hopefully folks have seen it. The first is really the broadest in scope and probably the most challenging in terms of implementing strategies, because it's really about addressing those root causes through system and policy change. So we have some folks who will talk about the progress we've made thus far in that area. The second strategy is expanding our prevention and housing programs. So over the last several years, we've learned a lot about what we're doing and what's working well and how we can do it better. We need to do more of what's working well and also continue to improve our system by doing things like getting more feedback and implementing that feedback from people with lived experience. The third area of work is even if we are working to address the root causes and really making change in that area, and we're expanding programs and able to house more people, we know that we can't do it tomorrow, and that there will be people living outside and people who are unsheltered that need more support for meeting their basic needs today and then to improve their quality of life. So that's kind of the framework for the plan. Next slide, please. We set out some pretty aggressive goals that are tied to all of the strategies throughout the plan. So the first is that we'll house 20,000 people through the supportive housing system. This is by increasing our programs like permanent supportive housing and rapid rehousing. And we want to achieve a 30% reduction in annual inflow. So one of the things that we learned over the last several years is that for every person we housed or assisted to achieve housing, 2 to 3 more became homeless in that time. So if we aren't addressing the root causes and more people are becoming homeless, we know that we won't make lasting change in the number of people that are experiencing homeless. So we set this aggressive target to reduce the number of people who are becoming homeless for the first time. We also set a goal to expand our homelessness prevention system. At the time, the end of 2019, our system was serving about 1,000 households a year. So we set a goal to more than double the number of families and individuals that we could help with prevention. We also want to double the temporary housing and shelter capacity. And as I said earlier, we want to track our progress and address racial inequities present among unhoused people and families. Next slide. So we have made some progress in the first year towards those 5 goals, those goals for the 5-year plan. First, in 2020, we housed over 3,200 people. So we still have a long way to go, but that was particularly significant, I think, because in that first year, so many of our service providers and our partners were so severely impacted by the pandemic and how they were delivering services, and the fact that we were able to continue to work on housing people permanently is a testament to folks' dedication to that core work that we're doing. Second, we expanded the homelessness prevention system from 1,000 to serve 1,500 people. That's aside from sort of the COVID financial and rental assistance that went on over the past year. But we're getting closer to that goal, and think by the end of this year, we'll have at a capacity to serve 2,000 households. On progress towards temporary housing, this year was a little tricky because we had reductions in the number of people that could be sheltered at some of our existing shelters because of social distancing requirements. But we actually, despite those reductions, saw an increase overall. So some of that increase was due to large temporary shelters that were set up by the county and the city of San Jose. And some of that is permanent increases to our system. So like the Life Moves Mountain View Home Key site that is opening this week, like the city of San Jose's emergency interim housing sites, like the Pedro Street project that is just also taking more people are moving in today. So we have made some progress, but we have some of that is temporary and some of it is permanent. The last is that we'll achieve that 30% reduction in annual inflow. And this one, it looks like we are very close to that goal, and that may very well be that we've made some progress there. We're also going to be tracking this one to understand the impacts of the pandemic, because most of what we know is based on the way people are accessing services. And we know that the way services are being provided was deeply impacted. So we are hopeful that there has been some progress made. We'll be continuing to monitor that as we move forward, though. And I think with that, we're going to talk a little bit about each of the areas of work. So I think I'm handing it off to Jen Loving to talk about what's been happening in Strategy 1.
Thanks, KJ. That's true. You are handing it off to me. And I just want to echo again, Celine, and just how rad you are and how amazing Lieb is, truly. So glad that you shared all that tonight. So we're going to talk a little bit about strategies. What are these things about? What are we working on? What does it mean? So strategy number 1 is exciting, because over the next 5 years, the goal is to really address the root causes of homelessness, the social, the economic, the racial disparities, structural racism, displacements, low wages, the lack of affordability. I think far too much time in the public square spent talking about sort of the personal issues associated with homelessness, and not enough time and that's used as some sort of it's used erroneously, and not enough time talking about the massive system failures that have contributed to homelessness in every jurisdiction in the entire country. And even if everyone who's on the streets gets off the streets, what we know every month is a couple of people fall into homelessness for every one person that gets out. So it's not acceptable to not address this from the root. And the intersection of justice and homelessness, of policies and practices that have kept us from making more progress. The amount of time it takes to bring projects online. KJ mentioned Pedro Street, which is a wonderful project that just opened today that we have been working on for a couple of years. And it's interim housing, right? And so building permanent supportive housing, everything takes a long time. So what are things that are happening to address these sort of root causes in the very short term? And I just wanted to give two examples. One is around the issues of displacement. So I mentioned 2 people fall into homelessness for every 1 that leaves, and that's just been sort of pre-pandemic. And so with COVID, what did we see once again? Families that are most vulnerable, lowest income, extremely low income families, most at risk of becoming homeless disproportionately, again, families of color. And so one activity that has happened this year is a massive community-wide effort to keep people from losing their homes. And that was a really beautiful movement where the public sector did their job and had eviction moratoriums in place. In fact, San Jose was one of the first cities, I think the first city in the whole country to move into a moratorium. And that moratorium is still in place, but right now it is set to expire June 30th. Over the last year, 70 different nonprofit organizations came together and distributed both direct cash assistance to families, but are also intervening and paying the back rent so that these families don't lose their homes. And this year, that this whole network has helped 15,000 households and distributed $36 million so far. 95% of that went to households of color. Another thing that we're doing that is future look going forward is basic income. And so Destination Home has been working with the Office of Supportive Housing and Somos Mayfair and the Cise Puente Collective around basic income pilots. Those are becoming more and more prevalent throughout the country, which is wonderful. We either have to have housing cost less or people have to have more access to money, right? Like to be able to afford to stay. And so we will be launching this fall a basic income pilot for about 250 households where we're really going to be focusing on women who are head of households, women that are in the rapid rehousing queue that are waiting for rapid rehousing, and provide a basic income for 24 months for them. So that's one of the things we're doing looking forward. I don't know if Key is still with us or if he had to go. Okay, so if he doesn't answer, okay. So I think that's all I have, and I'm supposed to turn it over back to KJ.
Back to me. Thanks, Jen. So in strategy 2, as I mentioned earlier, this is where we're really trying to expand housing programs as well as prevention programs. So we have been, Measure A has been tremendously helpful in helping us expand our permanent supportive housing programs. So we have new developments opening this year. We are expanding services to be able to support both the folks in our permanent supportive housing developments, as well as the rapid rehousing units that are being developed, and also our scattered site. And we do that and scattered site just meaning permanent supportive housing and rapid rehousing programs that are renting units across the community. We're applying for new funding via our continuum of care. We are utilizing some of the COVID, the CARES money that was made available this year for housing programs. We have a large expansion in a rapid rehousing program specifically designed to help some of the medically vulnerable folks that were temporarily housed in our hotels become permanently housed as they leave those hotels. So we're also increasing our prevention, utilizing private funding that Jennifer mentioned, as well as some state grants to be able to expand the capacity of people that we're providing immediate rental and financial assistance to stay housed, and I believe will be at least on target, if not ahead of target, at the end of this year for that expansion. We one of the examples I wanted to use of sort of as we do this work, we have a goal to create a state-of-the-art supportive housing system. And to me, a state-of-the-art supportive housing system is one that both is constantly using data to improve the way we do things, but more importantly, we're also working with folks with lived experience. And so one of the things that we implemented this year is in the way we procure services for across our homeless service system. We are now asking applicants for county funding to identify how they are going to prioritize both feedback from people with lived experience of homelessness, but also hiring and promoting people with lived experience of homelessness in their own organization. So that kind of system change, I think, will change the way we operate our programs and will improve all of our both our own programs as well as our partners. So there's just a few examples of things we've done in the first year. And with that, I'm going to hand it off to Reagan, who's going to talk about strategy 3.
Thanks, KJ. Good evening, everyone. My name is Reagan Henninger. I'm with the City of San Jose's Housing Department. And I'm going to go over a few of the things we've been doing related to strategy 3, which how I like to think about strategy 3 is really how we're caring for people who are unsheltered and how are we improving access to either street-based services or shelter interim housing. So one of the gifts of COVID, if there are any, has really been how quickly we've been able to implement strategy 3 recommendations that we were dreaming about over a year ago now when we were writing the plan. And then COVID hit. But when COVID hit, we saw a large influx of new state and federal funding that has really allowed us to quickly implement recommendations in strategy 3. So some of the examples in the last year that we have been able to do, we have increased hours of operations at 10 shelters and safe parking sites. We have created over 385 temporary shelter beds across several different locations. We've established a central referral hotline for shelters and hotels and motels that are also being used for shelter in place locations. We've expanded emergency motel programs for victims of domestic violence. There are 5 new interim housing sites. Some of them were mentioned by others. For example, San Jose constructed 3 sites since last spring. We also have the Mountain View Project Home Key site and the Pedro Street project. For San Jose specifically, we have expanded our street-based outreach services and street-based case management services in a program called SOAR, which stands for Services, Outreach, Assistance, and Resources. And we are doing this program at 16 of the city's largest encampments. But in addition to that, since last June, we have been providing garbage service at approximately 200 encampments in San Jose. And then finally, over 790 motel and hotel rooms were leased across 8 cities in the county to shelter homeless individuals who were vulnerable to COVID-19. So these are just some of the examples that we have been able to implement in the last year. It's not everything, the list is pretty long, but we do anticipate being able to continue a lot of these services even beyond COVID-19. And there is, in fact, a lot more work to do in this strategy. So I think that's it for me. I'm not sure who I hand it back to. Oh, Consuelo, I think.
Consuelo may have had to hop on another call, so I'll be brief here because I think many people are familiar with Measure A.
Sorry, KJ, I was
oh.
fumbling with my mute button, but you can go ahead.
No, it's all yours.
Thanks, everybody. For those of you on that know me from my previous role, the implementation of the 2016 Measure A has been my professional baby. We've mobilized very quickly over the last 4 years to create a pretty nimble and flexible program where if there's a development opportunity across the county, we will consider it. And if it meets all of the criteria and objectives, which align very closely with our community plan to end homelessness, we will package it for consideration of funding. And within this same period, and this is where people that watch and closely monitor our data might ask why this is different than what we reported to the board most recently in February. And this is capturing work through December of 2020, December 31st of 2020. And through that time frame, we've been able to fund 28 developments, of which 3,032 are new apartments. And 2 months after this data was collected, we went to the board with 5 additional projects and now working on a few others. I did just want to highlight, as Reagan mentioned, that there's been this opportunity because of COVID, or the blessings because of COVID, if there are any, is that the state released a project Home Key funds. And because of Home Key funds, we were able to add a few interim housing, but also one of the outcomes is the conversion of a 146 unit extended stay America in the city of Milpitas that is converted to 132 new permanent units in 6 months. And it typically takes 5 years from the time you identify a property until the time you have people moving in. And to be able to do something like that in 6 months and permanently house people, I think is one of the great outcomes that we can share of our work from last year. The governor is including funding, is proposing new funding for a version 2 of Home Key, and we are thinking ahead and planning ahead so that this number can be doubled, so that we can meet our goals in the housing plan or the housing development portion of the community plan to end homelessness. So I will hand it back to you, KJ.
Thank you. And I talked a little bit about the COVID response earlier, but we asked Hong Kao to join us to share some of the good work that has been done by our partners and the county and the city related to the COVID-19 response. So you can go to the next slide, and I think Hong is on to take it from here.
Hi, everyone. So as you have heard from our partners, and we have done, I think, a tremendous job countywide on our COVID-19 response. And this effort really would not have been possible with partnerships with the various community partners and the city of San Jose, and of course, Destination Home. So early in the pandemic, work together to mobilize a massive crisis response system. In partnership with our Valley Homeless Healthcare Program and Garnered Health Services, we've assessed and relocated the most vulnerable people experiencing homelessness into hotels and specialized emergency shelters with wrapped around services so that they can be safe and shelter in place from the pandemic. And as Reagan mentioned, under Strategy 3, we also implemented a new hotline last April 2020 to make it possible for the team to rapidly screen people for COVID-19 risk and place them into the various shelters. And as of February of this year, we have in total placed approximately 4,600 people in shelters. And the lived The Lived Experience Advisory Board, the City of San Jose, and our nonprofit partners, as well as volunteers, have ramped up a lot of street outreach, provided food and supply distribution, offered access to free COVID testing, distributed masks and other PPE, and created mobile sanitation and laundry facilities for our unsheltered households. And most recently, we have worked together to share information and inform our unsheltered households about vaccination safety and efficacy to get as many unsheltered households vaccinated as possible. Next slide, please. And this slide briefly summarizes our COVID-19 response funding. So in addition to our current resources, we've received $60 million in home key funding for housing in Santa Clara County. We've received $24 million in Federal CARES Act funding and $31 million in homelessness prevention assistance, which we have assisted more than 14,000 households. And then the county has also applied for FEMA reimbursement so that we can leverage more resources to what the costs that are reimbursable for or eligible for reimbursement so that we can provide more resources to our unsheltered households. Thank you. Back to you, KJ.
I think that's the end of the presentation, and we're gonna take a little bit of time for Q&A, but I'll defer to our facilitators if we're on schedule to take a few questions before breakout groups.
I think we can, take a few minutes for questions if anyone has any.
anyone
Feel
has
free to unmute yourselves or put them in the chat. Great, seeing and hearing no questions, I'm going to turn it over to Eli, who is going to introduce our breakout activity. Thank you.
Thanks, Byla. We are going to do a quick discussion breakout activity. We're going to put you in some groups with other folks in the event and have our facilitators guide you through 3 discussion questions that will help us reflect what have we seen in terms of community plan implementation since the beginning of 2020, and also what do we as a community think our priorities for implementation should be over the next 12 months, and then a little also reflection on what each of our individual roles is in that work moving forward. When we put you in a Zoom breakout group, it will be lovely if you have a camera that you can use if you turn your camera on, if you're able to do that. If not, that's fine. It would also be lovely if you have a microphone that you can use, that you unmute yourself while you're in the breakout group so you can have a discussion with your vocal cords and your human mouths. If not, that's okay. You're going to have the text chat box in the breakout groups as well, and you can definitely use that to participate. Before we send you into the breakout groups and let your facilitators guide some introductions and then some discussion questions, I want to share some ground rules that we'd like you all to respect for the breakout group conversations. I'm going to put these in the chat as well. So the first one is, if you're sharing a story about someone who's not in the room, keep that story anonymous. Please don't share the names of other people who are not in the room when you're sharing those stories. We ask that you listen to understand and also create space for others to talk. So this is, we want to hear from everybody in breakout groups, and we want to have a free discussion where everybody feels heard and listened to. It's ultimately very important that whatever breakout group you're in, whoever is in your group, that we are respecting the experience of all of our unhoused neighbors. This is a forum for discussing strategies to end homelessness. And finally, keep your comments general, not directed to other people in the group. So we're looking for sharing of input, not a debate session, a discussion session. Before we put folks in breakout rooms, I want to pause to make sure there are no questions. If you have any questions, go ahead and put it in the chat. All right, then Nicole, I think we can go ahead and open up our breakout rooms. Thanks, everyone. Welcome. We're going to do just a quick report out because you did such great work in your groups, thinking those thoughts and saying those words and creating ideas. So we'll do a quick report out and then have a little closing comments from KJ. So in terms of the progress that we've seen from January 2020, I think there was a theme of the COVID response was a big driver of all of the work that happened over the last year. So more trash pickup services, more creativity, resourcefulness. But we've also seen, and then new partnerships and policies that made it easier to ramp up programs. I think developing new partnerships and working with new people and in creative ways was definitely something we saw over the past year and a half. And then we also saw work that had been going on continue. So pipeline of housing developments, permanent supportive housing developments and opportunities coming online. We saw bridge housing properties coming online that had been in the works for a while. And then new San Jose housing transition in place program policies that we're working directly with property managers. And then in terms of what should be a focus over the next 12 months and what are the barriers, there was quite a range of ideas that you all sort of highlighted to prioritize. Definitely, again, the end of this eviction cliff that we all feel like we're approaching, making sure that we have resources in place for that. Continuing things that we sort of got to try during COVID. Scaling interventions like shared housing and roommate matching programs, funding for rental assistance and flexible funding, and then more access to behavioral health, mental health, substance use services. So really across the board, we can see that there's a lot of areas to prioritize. I appreciated seeing a comment about the several comments about sort of the coordinated assessment prioritization. So making sure that we have things in place for people who are not going to be prioritized for PSH or for rapid rehousing because of their VI-SPDAT scores, but also I think I saw a comment about looking at that coordinated assessment prioritization, looking at the assessment that we use and the way that we're connecting folks to programs and making sure that people are getting connected to the right intervention at whatever level of vulnerability they're at. And then generally reducing barriers for people who are receiving rapid rehousing. So we know rapid rehousing is a really challenging intervention in our housing market and in Santa Clara County. And then again, grounding us back in our overarching work to address the root causes of homelessness, specifically racial inequity in our community and in our country. So yeah, definitely seeing a lot of excellent ideas that can be priorities over the next year. And this is my favorite slide, just seeing all of the ways that you all can have the power and to make change in your spheres. So I think the ideas of spreading the word and educating your fellow community members came up a lot. And I think that working with the LEAB is sort of part of that. Using our colleagues with lived experience as part of our messaging and our communication with communities. And I think the Housing Ready Communities Action Network is another great way to inform and educate ourselves and other folks in our neighborhoods. So thank you all so much for those ideas and that work that you did. And I'm going to pass to KJ for a closeout.
Thank you, Eli. So thank you. I just want to say thank you again, everybody, for joining. I want to give a shout out, even though Celine had to leave, for kicking us off with an amazing presentation showing demonstrating the important work that LEAB is doing. And thank our my co-presenters from the Office of Supportive Housing, from Destination Home, But most of all, for the folks that participated, shared your thoughts, we will share these back with the folks that are working on strategies right now. We will provide more opportunities in the future to sort of, this is an opportunity to hold us accountable of how we're doing this work with the plan, but also gather more feedback. As you know, if we learned anything the last year, we learned that nothing stays the same and there's constant change. And so we have to evolve our plans and the things that we thought would work along the way. So again, we'll share that, but this is one tiny opportunity to share feedback. There are many other ways that I'll share my contact information, but feel free to reach out to me directly. But the Continuum of Care also has multiple groups that work in different areas and policy areas. And I know our partners at the Destination Home, such as and City of San Jose, also have ways to get involved, like the Housing Ready Communities Initiative and others. We'll share all the information that you did, but also please, if there's something else that you're looking for or interested, or some other way to stay involved, let us know and we'll be happy to share that information. So again, thank you so much, and thanks Homebase for facilitating and note-taking, Jamboarding. Appreciate it, and have a wonderful evening.
Thank you.
Thanks, everyone.